Hello, and welcome to the fall edition of On the Road with David Storto. I hope you all had a great summer and are energized for a full range of fall activities. This morning, I'm here at Spalding, Cambridge, to speak with Joanne Facile, who's the VP of Operations, and Brenda McPherson, who's a clinical nurse educator, about an innovative new approach to monitoring patient safety using technology called the Avasys system. Good morning, Joanne and Brenda.
Good morning.
Good morning.
Tell us about the Avasys system. What is it?
So we started using the Avasys system in December, and it's a continuous virtual monitoring system where we have a camera that is placed in the patient room where the monitor tech is able to observe the patient's behaviors and to intervene when the patient is having some unsafe actions.
He just put in his dissection in his mouth. Is that okay for him to do that?
So in addition to helping with patient safety, doesn't it help with nurse staffing issues?
Absolutely. So currently we have 8 cameras that are functioning. So one monitor tech is able to observe 8 patients.
Wow.
Instead of having 8 sitters sitting with those patients.
Wow. Now is this system going to begin to get used elsewhere?
Yes, we're actually working with Spalding Hospital Boston, and we're in the process of doing planning to expand it over to Boston with our monitor techs here actually monitoring the patients in Boston, and they're going to start with 3 cameras.
Wow.
And we're going to see how their utilization goes. So Partners 2.0 put a Tiger team together, and I'm co-chair with Kevin Whitney, and we're actually looking at expanding the utilization. Mass General just started using it a couple of months ago. Newton Wellesley is utilizing it. Faulkner is going to go live.
And I understand that you're receiving a special award in recognition of your innovative use of the system.
Yep, Avashore has some awards that they give each year, and one of them is the Safety Net Award, and that's the award that we're getting for the innovative use. We've used it for the patients pulling their tubes and trachs, and also for the brain injury population, which they're actually very fascinated by that because it's unique to our facility.
Different patient population than
Yes,
they're used to. Yeah.
Exactly, so monitoring the patient behaviors also.
That's great. And now I've made my way to our outpatient center in Brighton, where we specialize in sports medicine, and I'm here with Denise Frost, the site director. Hi, Denise.
Hi, David. Great to see you.
Thank you, thank you. You know, I'm gearing up to start training for the Boston Marathon again,
Right.
and I'm having a little trouble with my knee, and I thought, well, geez, maybe they can help me out in Brighton, given that focus in sports medicine.
Absolutely, we can. We certainly can send you off to see Dr. Ahmed right away. She's got some great analytical tools.
Hi, David. I'm Dr. Ahmed. Nice to meet you.
Hi, nice to meet you. Denise said you may be able to help me out.
Yes. First thing I would normally do is, just ask you some questions about how long this has been going on for and get a real nice thorough history from you. And after that, actually get my hands on your knee to examine the knee and see if we can come up with a diagnosis here in terms of what's causing your pain. And the great thing is here in clinic, I actually have a bedside ultrasound machine.
Oh, great.
Which is a really great adjunct to my physical exam because I'm able to place that ultrasound probe on your knee and dynamically be able to assess different structures in your knee.
So how's it look?
So given that all these structures that we've looked at look great, and thus I would highly recommend meeting with one of our physical therapists and movement specialists.
So, David, I'm going to show you a video of what I'd like you to do, and I'm happy to show you. So we go into a short lunge. So we're 3 foot lengths back.
Curious, we're here in the Boston Landing area. There's so much going on with all this athletic activity. You're treating other athletes too, right? Beyond runners.
Oh, absolutely. I mean, we're so close to the Charles River. We're very much involved with the rowing community and the recreational athletes. So it's an exciting place and time to be living and working here. I've already put together some of those exercises, and you'll find that you can see them already on your phone here. You get a video, you get a diagram.
That's great. So
Exactly.
I get somebody that's going to teach me how to do it again. 'Cause
Exactly.
I'll forget by tomorrow. Oh, great.
All right, so you've got that in your back pocket, so no excuses.
So I hope you enjoyed learning about our sports medicine capabilities here at our outpatient center in Brighton. We also have a lot of capabilities in some other centers, our National Running Center and throughout our outpatient network that we're so committed to growing. We'll be back for the winter edition of On the Road, also back in Brighton, where we'll be featuring the opening of our skilled nursing facility just a couple of blocks from here. So we'll have, within Brighton, our outpatient center focused on sports medicine, as well as our skilled nursing facility. So we'll see you again for the winter edition of On the Road with David Storto.
Bye.